Launched in 2007, Piedmont Heart Institute is different. Among Atlanta heart care providers, Piedmont is unparalleled in quality, technology, and key outcomes. But we've only just begun. Piedmont Heart Institute is unique in that it is physician-led. This model only exists in the world's top heart centers. When Piedmont invited Atlanta's best heart doctors to lead its new program alongside our CEO, they signed on, by the scores. And more top specialists are on the way.
We asked the physicians to form and run the Institute in a true partnership. That's a first in the Southeast. The result of the alignment of interests is better, faster, and more efficient care for our patients.
PHI is among the nation's largest cardiovascular practices. Beyond our hospitals, our nearly 80 heart specialists practice in 33 offices statewide. But large is not the goal. The goal is superior care. And we've already seen major advances in patient care and outcomes. Since forming PHI, our angioplasty mortality and complications have dropped 70%, far better than national averages. The benchmark for cardiac bypass is 1.6 deaths per 100 patients. At Piedmont, it's 59% lower. When a heart attack patient arrives at a hospital, national guidelines call for the artery to be unblocked with a balloon catheter within 90 minutes. At Piedmont, our success rate is 100%, and our average time is exceptional, 57 minutes. Piedmont Heart Institute's approach to quality is far from typical. Quality and IT is headed by a cardiologist with a PhD in biomathematical sciences. Dr. Mark Cohen and his team of full-time cardiac nurses lead physician peers in ensuring that care is based on the best of science. Here are a couple of ways. PHI exceeds guideline-based care. Piedmont was Atlanta's only hospital to earn the American Heart Association's top-level gold Get With the Guidelines Award in the 2009 Best Hospitals issue of U.S. News and World Report. PHI also makes exceptional use of electronic medical records. Each step of care is monitored closely.
Physicians work continually with our computers and information systems. The tools are robust and are designed to alert the physician if any step is missed. We work continuously with our physicians to help them succeed.
Piedmont Hospital's use of technology to advance patient care has not gone unnoticed. In July 2009, it was named a Most Wired Hospital for its 6th straight year. These documented improvements and others have come about through quality measures that are truly comprehensive. Piedmont Heart Institute is realizing tremendous success, and it is growing ever stronger. In August 2009, we welcomed 3 leading Atlanta cardiovascular surgeons, and very soon internationally renowned surgeons will join us to launch heart transplant and valvular surgery programs. Yet, even before PHI was formed, Piedmont's Fuqua Heart Center was already a regional leader. From 2005 to 2008, the latest published years, Piedmont achieved the lowest readmission rate for heart attack patients in Greater Atlanta. Today, Piedmont is the recognized leader. For the past 3 years, Piedmont was named Best in Atlanta for overall cardiac care and cardiac surgery by the nation's leading independent healthcare ratings company. We also earned HealthGrade's 2010 distinction Best in Atlanta for coronary intervention, and we earned the 2009 Cardiac Surgery Excellence Award and the 2010 Excellence Awards in Cardiac Care and Coronary Intervention, placing our clinical outcomes in the top 10% nationally. It is patients, however, who tell our story best. Ask Tom Dix. In 2009, the 50-year-old Peachtree City resident suffered cardiac arrest after an afternoon walk. 2 hours later, collaboration between physicians raised his chance of survival from not likely to more than 70%. Dr. Victor Corrigan had opened the blocked artery, but Dix remained in cardiac shock. Dr. Vivek Rajagopal proposed using a cardiac assist tandem heart, which he had introduced at Piedmont a year earlier. Examples of such life-saving measures abound at PHI. Beyond clinical expertise, Piedmont Healthcare is well known for being exceptionally caring. Consumer Reports online health report rates Piedmont Hospital #1 in Atlanta for patient satisfaction and for doctor and nurse communications. AARP magazine also ranks Piedmont Hospital first overall in Atlanta. The goal, of course, is to prevent heart disease. Through extensive in-house research, PHI has advanced genetic testing to enable us to detect, slow, or even reverse heart disease at its earliest invisible stages. In 2008, PHI's Family Heart Disease Program examined first-degree relatives of people with known heart disease. Family history is an accepted risk factor, but research is limited. For each subject, we obtained a 3 or 4 generational medical history. Beyond CT calcium scoring, we analyzed blood very closely. We were actually able to see which pathway promoted the disease in each person. Here's just one important finding. Of the family members without known heart disease, 21% had plaque buildup, some extensive. Based on current guidelines, none of those patients would have qualified for lipid-lowering therapy. Our comprehensive evaluation, however, resulted in aggressive therapies unique to each patient's genetics and biomarkers that slowed or stopped the disease progress early.
From a prevention standpoint, we're unparalleled in the region. In medical science, heart disease prevention is still rudimentary. It's the next big frontier, but the clock is ticking. Heart disease accounts for 36% of all deaths. And of the 700,000 Americans who die each year, nearly half die suddenly without symptoms. Our goal is to identify heart disease at least 10 years before it's clinically apparent, and we're well on our way. New blood marking and imaging techniques let us look at the subclinical disease early, so we can actually treat it. We have proven that we can shrink and stabilize plaque in arteries to lower the risk of heart attacks as well as strokes.
Why does Atlanta need a world-class heart center? Because our region has the highest rates of heart disease, stroke, diabetes, and obesity. Because patients who can leave the Southeast for treatment. Because Atlanta is a national business, governmental, and educational hub. Because a world-class heart center will not only benefit the region's economy and attract other leaders, it is vital to our quality of life. Without community leadership and philanthropy, however, PHI will never reach its potential. Our operating margins, especially with healthcare reform, cannot pay for top physicians and vital technology, let alone research, innovation, and education. Yes, we'll keep improving efficiencies of care and standardizing processes, and keep providing excellent outcomes. But only philanthropic support will propel Piedmont to the forefront of heart care. Greater Atlanta needs access to the best in medicine. It's time for Piedmont Heart Institute to recruit you. We've already recruited top cardiovascular specialists. Our patients already receive excellent care. Now we invite you Atlanta's thought leaders and opinion makers to join us in our mission to stand among the nation's top heart centers to provide this region with the very best in heart care.